morning, guys. This is Miss McLean, and I'm going to be talking about urinary elimination today. I, as always, want to ask for your grace as everything that I planned to do this morning and yesterday completely and totally fell apart. This PowerPoint, including our quiz, Are You Smarter Than a Fifth Grader, are all uploaded in Moodle for y'all if you want to open it up and take notes. However best it works for you. We're probably going to be doing this in different sections to make it easier to upload to YouTube so that y'all can watch at your leisure all this fun and exciting information about urinary elimination. So this is my first time to video a lecture. Let's just see how it goes. And if you have any helpful hints or anything like that, please email me. Most of my lectures will probably be in this format, and I want them to be as interesting as possible for y'all since I'm not there. Okay, guys, we're going to talk about urinary elimination today, and as most of y'all know, that's one of your basic functions. So it's always important to know kind of what's going on with someone's input and output, and so the urinary system plays a large role in that. Okay, so this is basically just an overview of where things are and how it's important. The biggest thing to know is that your kidneys are a whole separate little compartment in your body. It's not part of the abdominal cavity. It sits close to the rib cage, not in your perineal cavity. It says the kidneys lie on either side of the vertebral column behind the peritoneum and against the deep muscles of the back. You'll notice that a lot of people who have kidney infections will say that they have flank pain, and so that's a big indicator. You want to make sure that you know what the kidneys do. They do a lot for us. I don't really specialize in urinary elimination, so I learned a lot preparing for this lecture just because it was just a good overview of what all the kidneys do. I knew they were important, but I kind of had forgotten what all they do. Some of the really important things that they do is they produce erythropoietin, which helps with red blood cells being produced. They also help, which we all know, with blood pressure control with the renin and angiotensin, y'all. It's way too early. Do y'all see what time it is? It will be 7:30. I was up at 5:30. Bless. It also helps calcium and phosphate regulation that produces a substance that converts vitamin D into the active form. So you can be out in the sun all you want to, but unless your kidneys are going to change that vitamin D into active form, you're really just getting a sunburn for no reason. The normal urine production per hour is 1 cc or 1 milliliter per kilo per hour. Okay, quick quiz. I'm also doing this on my phone, so if you see anything fun and exciting pop up, like random notifications, that's why. I know my garage door is open. It'll show up in a minute. So we're talking about a patient. Oh, there we go. My husband just left for work. A patient with a long-standing history of diabetes is voicing concerns about kidney disease. The patient asked the nurse where urine is formed in the kidney. The nurse's response is, okay, I'm all hoping that y'all pick C, the nephron. That's exactly correct. The bladder stores it. The ureter drains it from the kidney. Okay, next up, we're going to be starting to talk about Miss Valero. Miss Valero is a 65-year-old woman who has been in the hospital for 4 days with problems related to heart failure, fluid retention, and diabetes. She has a history of urinary retention secondary to neuropathy caused by her diabetes. Miss Valero's indwelling urinary catheter was removed 2 days ago and subsequently was replaced yesterday at 6 a.m. because of her inability to urinate more than 100 mLs of urine at a time, being incontinent of small amounts of urine, and complaints of urinary urgency and lower abdominal pain. Okay, Sandy, who is a student nurse, learns about Miss Valero at 3 p.m. Okay. So the act of urination, I didn't realize exactly how much, sorry y'all, let me go turn the lights back on. There we go. Sorry, it's all about, conserving energy here at the Madison County School District. So we have little sensors in our room, so I'm not moving enough, so I may have to get up and move around in a second. So the biggest thing to know is that creating urine is a whole body process. It involves your brain, it involves your kidneys. It's quite an interesting process. In my room, and I'll show y'all if we're not running over, I have a word wall. So I really would love to create a word wall with y'all today on words I wasn't 100% sure what they were. That's right, guys. I'm a nursing instructor. I'm teaching you, and I don't know everything. Believe it or not, learning is a constant state, and if you don't use it, you lose it. So there's always going to be stuff that you don't know. So anyway, we're going to be talking about brain structures that influence bladder function. Micturition. I meant to Google, so I knew that I'd pronounce it right. Is also known as pee-peeing. I prefer pee-peeing a lot better than this fancy word, but for the process of professionalism, we'll be looking at that today. It's a complex interaction between the bladder, the urinary sphincter, and the central nervous system. Okay, the bladder holds approximately 400 to 600 mLs of urine at a time. And most people experience a strong sensation of urgency. It's when patients don't feel that strong sensation of urgency that it can become a problem. Okay, guys, factors that influence urination. We've spent the last 2 weeks at a nursing home. So what do you think is the one thing that we've learned that factors into influencing urination? Okay, did anybody answer? Okay, I didn't think so. So I'm going to pick on my clinical group. Carl, what have we learned that is one of the most important things that that is a factor influencing urination? Since we've been at the nursing home taking care of our older patients. Okay, I'm assuming that you could read my mind and picked age. And you're exactly right. That's one of the biggest things that we've learned over the last few weeks. Children typically are not ready to potty train until 18 to 24 months. We can go all into that specifically in your pediatric lecture. I could talk all day about pediatric patients and potty training. You have to make sure that they have the need to void and the understanding. They'll start asking questions, recognizing that the bladder is full. They'll hold urine. They'll hold their pee-pee for a while. And they'll go further distances between wet diapers. It's important to know. I thought this was really funny. How many of y'all have ever gone to overseas to, say, Africa, the continent of Africa? It's not a country. The continent of Africa, Kenya, Nigeria, anywhere like that. Or have you ever heard of a squatty potty? I personally am terrible at squatty potties. If you want a mess, please give me a toilet that is not, that I can't sit on. It's a disaster. I'll explain later when you're not recording me and I'm not publishing this on the internet for all to see. It's important to know that there are different cultural and gender norms. They vary. A lot of countries, it is normal for you to sit, like actually sit, and go to the bathroom. In the United States, it is, sorry, y'all are seeing all my stuff. Here we go. There we go. It's normal for people to sit on a toilet in most developed countries. In developing countries, it is normal for them to squat and go to the bathroom. So it's important to know when we're thinking about things like that, looking at where your patient's from, and different aspects of their culture when it comes to making sure that they're going to the bathroom appropriately. Let's see. It's also important to know if there are any religious or cultural norms that may dictate what's acceptable. Just because patients live in the United States doesn't mean that they hold all of our values of our modern culture, where it doesn't matter if it's a woman helping a man or a man helping a woman to the restroom. It's also interesting to know. I highlighted these because I kind of giggle because I've always heard different things. I didn't know that they were actually true. Alcohol decreases the release of the antidiuretic hormone, thus increasing urine production. So it's true. You do go to the bathroom more when you're drinking alcohol. Um, So the biggest thing, so we've looked at growth and development, cultural factors, psychological factors, personal habits is huge. How does a person typically go to the bathroom? Your body has muscle memory, and you can train your body to go to the bathroom at certain times. That's why you may notice that everybody gets up and goes to the bathroom in the morning. Well, most people do because, first of all, your bladder's full. But specifically, I've noticed that teachers go to the bathroom. It's just a natural thing for them to go to the bathroom at certain times during the day because their bodies have been trained based on the bell schedule to know when they can go to the bathroom. It's quite interesting. You will learn as a nurse and nursing student that you learn to hold your urine for long periods of time just because of time factors. Let's see, what else I highlight on here that's interesting. It's also important to know that whenever the sterile urinary tract is catheterized, there's a risk for infection. That's going to be one of our biggest nursing diagnoses for any type of alterations in urinary elimination. Y'all, this is acting up this morning. Let's see what's going on. Here we go. Okay. Let's see. We're going to talk about this case study. So Sandy notes that the urinary catheter was removed at 7 a.m. this morning for Miss Valero, and the patient has no recorded urine output for the day. Miss Valero verifies that she has only dribbled urine while making rounds. Sandy talks with Miss Valero, who says she is worried because I thought this was all under control. The healthcare provider is notified, and an order to obtain an intermittent catheterization is received. The registered nurse on the day shift catheterizes Mrs. Valero at 3 p.m. And returns 600 mLs of pale, clear yellow urine. So, what do you think's going on with Miss Valero? Miss Valero has a decreased sensation to void because of a urinary catheter being placed, which is common in a lot of patients. Got a text message. Sorry, guys. As Sandy prepares to assess Miss Valero again, she remembers that urinary problems are common in patients who have diabetes and in older adults. Age alone does not cause incontinence. She recalls that patients with urinary retention sometimes leak or dribble urine and then are misdiagnosed with incontinence. Stress incontinence is huge. You have to think about muscles. Muscles weaken over time, specifically if they're not used. And so you have to think about all those sphincters that have been used that you have to think about. Y'all, it's fixing to blow up. These girls in a group message, and it is like one after another. Okay. Sandy also knows that that patients generally void at least every 6 to 8 hours, and that Miss Valero's recent catheterization has decreased mobility, and with her history of diabetes, makes her prone to urinary retention, incontinence, and urinary tract infections. So we think about Miss Valero, and we know that she's got issues with incontinence, she's got issues voiding, she has diabetes, she's older. What are some things that you think we could do in order to help Miss Valero? You can talk amongst yourselves. Okay, guys, I learned the most about elimination programs when I did clinical with another school of nursing on the ortho floor at UMC. Toileting programs. Do y'all know what I'm talking about when I say toileting programs? Well, basically what we do is we train the body to void at certain times. Remember that muscle memory I was telling you about earlier? That's something that we could do. We can also do a bladder scan. Specifically before we catheterize a patient, we want to make sure that we're not just doing it for fun, that we have a reason to, that their bladder is containing urine. We want to know, how is she drinking? Does she have a feeling of urgency? Can we palpate the bladder to see if it's full? Okay, so now we're going to be talking about common urinary elimination problems. We've got retention, urinary tract infections, and urinary incontinence. The most common urinary elimination problems involve the inability to store urine or to fully empty urine from the bladder. There's multiple causes for this. Infection, irritable or overactive bladder, obstruction of urine flow, impaired contractility of the bladder, and issues that impair innervation to the bladder, resulting in sensory or motory dysfunction. Lots of causes of urinary issues. You have to think specifically as patients get older, or children who have had some type of spinal trauma or spina bifida, anything like that. They're going to have issues with those nerves that control the bladder. So we know what urinary retention is. Urinary retention is when you retain urine. It's pretty simple. Because you can't completely empty your bladder. A urinary tract infection, we all know what that is. It is not fun, and it's not fun for our patients. And neither is urinary incontinence, that voluntary leakage of urine. It's important for y'all on your notes. My husband just texted me. On the bottom of your PowerPoint slides that I've loaded, if you print them with the notes, all of this information that I'm going over is here. It's also in your book. These are standard book publisher slides. So I'm not really giving you anything extra right now, but it has some really great information. One of the things I love is that it tells us what is usually the cause of UTIs. What bacteria do you think is the main cause for UTIs? Hey, Kaylin, tell me, what bacteria do you think? Okay, I'm hoping that you said E. coli. Where do we find E. coli in the body that's commonly close to your urethra? Ty, where do you think we find E. coli close to the urethra that may cause a urinary tract infection? Okay, I'm assuming that you said your duty. You're exactly right. E. coli is commonly formed and kept and hangs out in your intestines and your rectum. And when you poop and you don't wipe correctly, it's easy for bacteria to move from that area to your urethra. And that is the most common bacteria that causes UTIs. So it's important when we're telling our patients, specifically our kiddos, peds nurse coming out in me, how to correctly wipe. At the nursing home, we have to make sure that our patients get clean, because not only are they sitting in poop and pee, they also have to make sure, just because of their mobility, that we really get them good and clean, because E. coli is the #1 cause of UTIs. USA Today. I don't need anything about USA Today. Ho. Let's see what we got going on. Here we go. Okay, now we're back. Common urinary elimination problems. We've already talked about that. Okay. So now we're going to talk about urinary elimination problems, but more when we divert it using an external source. So we can see, let me turn my computer on really quick. Okay, that's better. We got 20 minutes. Cool. Okay, we're going to talk for just a few more minutes, and then we're going to stop and take a break because I know that y'all are just so excited about me doing this recorded lecture. Okay, so nephrostomy tubes, as you can see on your PowerPoint or hopefully in your book that you're following along, you can have different types of devices that move urine from inside your body to the outside of your body if things aren't working correctly. So you have nephrostomy tubes, which are small tubes that are tunneled through the skin into the renal pelvis, and they are drained. They use them when the ureter is obstructed, and patients go home with these tubes and need careful teaching. What do you think the number one nursing diagnosis is going to be for a patient with a urostomy, or excuse me, a nephrostomy? Okay, infection. So what do we know? Why would that be an issue that we were worried about? What do we know about the urinary system? It's sterile. Okay, bacteria is not supposed to be in there. Unlike your intestines, where there's bacteria in there automatically, just kind of hanging out, or in your respiratory tract, that you have those protective mechanisms to get rid of that bacteria. The urinary system doesn't have that. So it's really important for us to prevent infection. No worries, that was just the bell that the kids can enter the building. Okay. There isn't any normal flora or any other type of protective mechanism. So we want to make sure that we are helping keep our patients safe, and the biggest risk for these patients is infection. Okay. Now we've got a quick quiz. Oh, here we go. Here's the nephrostomy tubes you can see in the renal pelvis. They're tunneled, they come out of the skin, and then they're drained into bags or a pouch. Okay, quick quiz. A healthcare provider may suspect that a patient is experiencing urinary retention when the patient has the answer is D. Small amounts of urine voided 2 to 3 times per hour. Okay, that sense of urgency means that the bladder is filling up, but they're not able to void all of what's in their bladder. Okay, we also want to make sure, big nursing diagnosis right now is going to be getting a bladder scanner to check and see what their residual urine is in their bladder. Okay, large amounts of voided cloudy urine. What do you think that may be? Okay, a UTI. Okay, good job. Okay, so we're going to take just a break. We're going to take a break for just a minute and let y'all breathe. And I'm going to try to preview the rest of our stuff because we've gotten through 15 slides in 20 minutes and we got to pick up the pace a little bit. So I hope y'all guys are having a great morning, and I'll be right back.